into the second phase of the hip arthroscopy. We like to maintain a passive range of motion of the hip to keep that hip from sticking or freezing up. So what I'm going to go over next is some of the things that we do to passively move that hip through a range of motion. So I'm going to lay Emily back here. So we would start with some gentle stretches of the hip, just bringing it up into flexion. And all of this is under the therapist's power, so she's just relaxing. And we would hold a few of these stretches for up to 30 seconds and do a couple of them at a time. We would work on hip flexion and things like external rotation. We would also maintain some of the glute flexibility. So anything that surrounds that hip while that could be aggravated after the surgery. While she's in this position, I also want to go over some of the other strengthening exercises that would start in the second phase, so about 3 to 4 weeks after surgery. So what I'm going to have her do now is we're going to work on some of the hip flexors. So she's going to straighten this leg out, and I'm going to have her bend this knee. So she's going to do a straight leg raise. What I want you to do is tighten this muscle up here like you're just trying to flatten that leg out. And then keeping that leg as straight as you can, I want you to lift. You're only going to lift about halfway between your shin and your knee, and then right back down. I want you to fully relax that leg at the bottom each time, and then refire that muscle to bring that leg back up. That's going to make you refire that muscle and gain control of it a little bit faster. So we would do about 20 of these, no hold at the top. So then the next exercise we would do for the hip is I'm going to have you roll over onto your right side. She's going to do a exercise to work on the glute med. So she's going to keep this bottom leg bent, and she's going to keep the top leg in line with her body. I'm going to have you lift that leg for me now, hold for just a second or two, and then back down. Same thing, I want you to fully relax at the bottom, and you would do about 20 of these, so I'll have you do a few more of those. Okay, so that works on the side of the hip. And then the next thing we would start to work on would be the back part of the hip, so the glutes. So I'm going to have you roll all the way to your stomach for me. We're not only going to work on the glutes, but we'll work on the hamstrings also. So we're going to do 2 different types of hip extension exercises. So the first one's going to be very similar to the last 2 you saw. You're going to keep this leg straight, and I want you to lift it as high as you can before you start to feel the tension in your low back. I want you to keep all of that tension in the glute. You're going to hold for just a second or two and fully relax at the bottom. That way you're refiring that glute every time. Same thing here, you would do about 20 of these. After she's done about 20 of those, we want to take the hamstring portion of that out and work only on the glute itself. So she would bend that knee, and now you're going to do the same thing, thinking about taking that heel straight to the ceiling, but only going as high as you can before you feel that in your low back. Hold for just a second or two, and then you're going to relax at the bottom. Same thing, about 20 of these. So when she's done with that, she can have a seat on the side of the table. Next, we'll show a little bit of a progression for just isolating that hip flexor muscle. So just sitting on the edge of the table, she can do a seated march or a single leg march. She's just going to bring that leg up, hold for a couple seconds, and then take it back down. Same thing with all the other exercises. We would do about 20 of these to start with and slowly progress up. So those are the progressions for the first few weeks. After about 4 weeks, we would start to progress to some weight-bearing exercises, which are fairly similar. So next we'll go over some of those.